are available. All right. Hi, everybody. Welcome to the second of 3 sessions related to data use and visualization. We're excited that you're here with us for session 2 and look forward to engaging in some actual practice related to creating some data visualizations for audiences that you work with. Next slide. I am Jennifer McKeever. I am with We Public Health, which stands for Women Entrepreneurs in Public Health. We are a collective of consultants who come together as teams to do work for clients who are creating a more just and equitable world. Next slide. So as we work together today, just want to set the stage for a few things. Those of you who were with us in the first session, you know we tried hard to get you to come off camera and we were not so successful. We're going to try again this time. We have some breakout rooms and opportunities for you all to connect. It's really helpful when we can see your face, understand if you don't have a camera or you can't. We're very much a come as you are group. You don't have to look your best. And if you need help at any point during the session, you can either send a chat to Erica or Mary. We'll also be available through the events at We Public Health email to answer any questions. Next slide. And so with that, I want to pass it back to our amazing trainers today. We're going to start with Mary Carney, who can introduce herself, and then Dr. Erica Horn will be joining us shortly. Thank you.
Thanks, Jennifer. And welcome, everyone. Thank you for being here and joining us today. So I'm Mary Carney, and I am excited to be the main presenter and facilitator today about data visualization. I've been working with We Public Health for a few years now. I'm based in Syracuse, New York, and I have a background in public health, worked at my local public health department, and I have been studying data visualization for at least the last decade or so and use it all the time as a consultant in my work. So I'm really excited to get into the content today. So this is our roadmap for the training series. If you were joining us 2 weeks ago for session 1, you'll know that we focused on finding data from and looking at some of the national sources of public health data that is relevant for infection prevention and control. And then we worked to practice analyzing and aggregating that data so that we could get it ready for data visualization. So today, we are moving forward and focusing on learning data visualization principles. Coming into this session, we're assuming that for the data you visualize, you have found good, relevant data that you want to create a chart or a map or some visual from. So we're going to talk about how we do that and spend a lot of time working in Excel. 2 weeks from now, in session 3, we're going to focus on learning to work with the many different data visualization tools available to us. So we will go beyond Excel into other software that you may be using in your health department. So that is our plan. We are going to get started with a little icebreaker. And we primed you for this in the email that was sent before the session. But what we want you to do is tell us what your favorite source is of great public health data visualizations. So in other words, when you think of the different charts and maps that are used to visualize infection prevention and control data, what websites do you go to for really good eye-catching visualizations? So if you have an answer, put that website in the chat. And I'm going to do the same. I'm going to share one of my favorite sources, which is your local epidemiologist. I don't know how many of you subscribe to that newsletter, but I find it is a great source of different charts that are really relevant to timely information about all sorts of public health issues. It originated with a lot of focus on COVID, but now that there's been visualizations shared there about the flu and all sorts of different diseases. So that's one of my favorite sites. But just me, or am I not seeing people put their favorite websites in the chat? No one has a good source? I have a second one if you if you want mine. There we go. All right. I see a dashboard from Minnesota. Let me see. Make my chat a little larger. So Forrest is sharing a dashboard. Forrest, would you mind coming off mic to tell us about that dashboard and why that you like that one?
Yeah, I use it a lot for it uses electronic health records from all the hospital systems, and it's estimated to cover about 90% of our population. And it covers anything from like mental health to physical health, anything that will show up in an EHR record.
That's great. Yeah, that's such a wonderful, rich source of data. I have a past life working with our local organization that does health information exchange for the region, and those groups can be a great source of data for your community. I'm also seeing Dr. Jetalina mentioned in the chat. She is one of the great teachers out there about data visualization. So yes to that. And Stephanie Evergreen of Evergreen Data, another another one of my data visualization heroes. If you have not checked out her website, I very much encourage you to. That is a great one. Bernard, do you want to share anything about the training that you took?
Hi, and thank you for holding this. It was back in 2018 at our health department, and Dr. Evergreen came and we did an in-person workshop with us where we got similar to this, opened Excel and did all the charts in Excel. And so her philosophy is make simpler, less complicated visualization. So some tricks and tips I've learned. For your chart title, make it a sentence explaining what your graph or figure is trying to say. Get rid of axes and legends if you don't need them. And then gap width. So remove as much white space from your graphs and figures as possible. So it's a little bit it kind of goes against sort of the classic scientific way of presenting stuff, but it's a lot more eye-catching and easier to read, I found.
Yes. Oh, I'm so glad that you're sharing all this. This is very much aligned with what we are going to talk about today, and I'm really glad for you to share what you've learned. And hopefully, we can all build on wherever we are with our learning journey with data visualization by sharing today. Um, thanks. And Erica, I see you have joined us. Welcome. Do you want to chime in and introduce yourself and talk about Florida charts?
Sure. Good afternoon, everyone. I am Dr. E, and I would say for my time working at the state, I'm dealing with a lot of state data and county specific data. Florida Charts is one of those websites for us that we could use in our state. It has a dashboard, and you can always compare state or county to county or county against the state. So when making recommendations at the local level, it was a great resource for pretty much all things related to Department of Health needs.
That's great. Thanks. I just put one more link in there. It is not specific to public health, but it does include a lot of public health relevant data visualizations, and just a lot of very, nicely designed visuals that you might find interesting. So, thank you, everyone. We're going to move on to our agenda here today. First, by introducing our objectives. So we're hoping that through this session, everyone learns more about how we can design clear, accurate, and engaging visualizations. We're going to focus on making sure we have accessible and inclusive visual design. So we'll talk about the principles of accessibility and some of those techniques that Bernard already mentioned that really help visualizations be clearer for a lot of people. And lastly, we are going to actively, get hands-on in Excel, as we mentioned, and transform some of the data that we started working with 2 weeks ago into some compelling visual stories. So that is our plan. The agenda, high level, is that we are going to spend most of our time in group activities and discussion around data visualization. We'll have a break in the middle here at 2:55. And our goal is to spend a good half an hour in hands-on work in Excel before closing out. Throughout this session, I invite you to chat with Erica or Jennifer if you need any help. They're both there on camera and available in the chat with any questions as we go. And I do encourage everyone to ask questions. So you can tell we, want you to engage. We want you to come off mic. We do not want this to be just me talking at you for this entire session. So please engage and ask questions as we go. All right. So our focus today is, broadly on infection prevention and control. You all work in infection prevention and control, I gather, and that requires a lot of engagement and communication with different types of audiences. So sometimes you are communicating with skilled nursing facilities, other times hospitals or other healthcare providers. You may have to communicate with the state agency or Board of Health or funders or all sorts of entities to describe how disease is spreading or which groups are highest risk. There's many ways you are charged with communicating all the time, and all the broader learnings you have about communication are relevant today. But data visualization is a subset of that communication. It's the specific focus on how we take data, raw information, and turn it into compelling visuals and images that communicate our message more clearly. And within that data visualization focus, we've decided to focus specifically on visualizing quantitative data. Many of the principles we talk about today will apply to the visualization of qualitative data, but we're going to stick with visualizing numbers just because we only have 2 hours with you all today. Another way we are focusing today's session is on explanatory data visualization. So I want to distinguish between 2 different broad categories of data visualization, one being exploratory and one being explanatory. So exploratory data visualization is data visualization that helps us to analyze our data and explore it to find those key insights that we want to communicate in explanatory data visualization. So in the exploratory phase, that's when we're making our quick pivot charts. That's when we're applying color maybe to a data set to find out where rates are highest and really to understand the meaning of our data. Explanatory data, what we're focused on today, is when we have a communication goal with our visual. So that is the focus. Does anyone have any questions before I move on? Okay, so seeing none, we're going to transition into a small group exercise using a Miro board. Okay, so I'm going to pull up a Miro board, and the goal of this exercise is for everyone to share what you already know about what makes data visualizations effective. Okay, so what makes them engaging, what makes them accurate and accessible. So I'm going to pull up the Miro board and share that. Can everyone see the Miro board on my screen now? Thumbs up.
Yep.
Okay, great.
You put the link
And
in the chat, Mary, as well.
great. And I was just going to say that it'll be in the chat. So I know many of you may have used Miro before and be familiar, but for those of you who haven't, we're going to hone in on the area in the center with the Post-it notes. I see many of you joining this board already. So we added all of these charts around the outside, mainly for you to reflect on the questions that we have here in the very center. So let me hone in on these and show you these questions. So broadly, like I said, what makes a data visualization effective? But then specifically, we are prompting you to answer questions about what makes charts and maps communicate data accurately. What makes them easy to understand? What makes them engaging? And so if you have not used Miro before, try to hone in on my cursor. I know there's a lot of cursors flying around here, but if you haven't used Miro, if you want to add something to a Post-it note, you can just click on it. Click twice if you need to get your cursor in there, and then start writing your idea. And it will populate, okay? And we're going to go into breakout groups for everyone to work on this. So the plan is for us to be in breakout groups for 10 minutes. And while we're there, I want you to take just a minute or two to introduce yourself, say what health department you're at, share with your colleagues for just that minute or two. And then on your own, take 2 to 3 minutes to add your thoughts to the Miro board and then discuss them with the group. Okay. We'll share these instructions again when you're in the groups. But before we send you off to groups, does anyone have any questions? Okay, so seeing none, I'm gonna let Jennifer open up the breakout groups. You click join if you just got a pop-up on your screen for the breakout group. And when you click join, you should be off to a small group with other people. If you didn't see a pop-up on your screen, usually you can just click those 3 dots at the bottom of your Zoom screen and select breakout groups. And you will then see the prompt to join a breakout group. Is there anyone who does not see how they can join the breakout group? Welcome back. Right. Do we have everyone back now? Looks like it. All right, so we're going to talk about the many, many things that everyone has been adding to this Miro board. I know I heard some really interesting conversation in the groups I joined in on. So you all have a wealth of knowledge. So I encourage you to chime in as I'm going along. So Jennifer, if you want to zoom in on that first area of accuracy, let's start there. Okay. So, um, someone wrote, it's important to identify the most relevant data points for your message. Okay. And can the viewer accurately describe the data to another person? So, does someone who wrote one of those want to share what they mean by that? How about that first one, identifying the most relevant data points for your message?
Mostly I meant like not overwhelming the viewer with a lot of unnecessary data, because some charts, some graphs can get pretty overwhelming, especially for non-data minded people. So you kind of got to simplify it a bit and make sure you really identify what you're trying to get across.
Yes, that most relevant data points, part is key, right? You need to find something that it is just what the person needs to know, ideally. Absolutely. And I see in the chat, in the Evergreen training, she recommended making the data points you want to focus on a stronger color and having your baseline data gray. And yeah, I've seen that technique used many, many times. Lots of data visualization teachers are using that guidance now, and I see that I see that on the Miro board too. Is that a lot of people talked about the use of color as highlighting what is significant. It's right there in the middle in the accuracy column. Um, so I think a lot of people are getting at similar things. We want to simplify, make sure we don't have hidden data legends. What does hidden data legends mean to people? Who brought that point up?
Oh, that was me. That kind of comes from if you've ever had this unfortunate thing happen to you where you're looking at a graph and you think you're looking at one thing, and then all of a sudden you're reading some fine print in like a footnote or something, and then it changes how you're interpreting that graph. It shouldn't be so hard to understand a visual. It should be very simple to see what it is, because that's how you get a lot of distrust, because all of a sudden you're not looking at accurate information.
Absolutely. Yeah. So the transparency is key. We want to make sure that we maintain our authority as communicators who are trusted by not having really relevant, important information about the meaning of our data hidden in fine print anywhere. That should not be the case. Great. So let's see, I see including key points or interpretations in the visuals, using the right chart or map type, labeling clearly. Yes, tell me more about labeling clearly. What do we know about the importance of labels? I know this sounds in the weeds, but there's a lot of guidance around labeling that we think about when we are making charts and maps and such. Does anyone want to share tips for good labeling, clear labeling? Okay, we'll come back to that as we go, but you need to make sure that it is obvious for people what your data are referring to. So axis labels or direct labels, whenever possible, are best practice these days. So moving on to that second column, I see colors that don't contrast against each other. Again, very, very important. And the shading your colors to highlight needed information. So, and I see things all over this board about color, even in the right column. It says using lots of different colors, the right amount of color. So if you are someone who wrote something about color, tell me what do you think is most important for people to know about color? Does anyone want to explain their post-it note a little more?
Mary, I'm curious about who wrote colors that don't contrast against each other, because I'm curious, whoever wrote that, do you mean, because I would think you want different colors that are contrasting. So I'm curious the thought there.
Hey, yeah, sorry, this is Romaldo with Cook County. I made that comment. I think I might have not worded what I intended correctly. I just meant like, let's say you have like a dark blue background for whatever reason, and you decide to use black text, like that would not be easily readable. You would want like white text.
Got it.
That was my thought process.
Thanks.
Yeah, so what you're talking about with color contrast there is really important. So we want to make sure that the colors we use have sufficient contrast, so people can read them clearly. That's one way that color contrast comes into play. So we don't want dark text on a dark background for sure. We want only lighter text on dark backgrounds. Or if you're using a light color, make sure there's sufficient contrast and a dark background so you can read it. There's also wanting colors that don't clash, right? That's another thought I had as you were writing, which is it's the rule of making something visually pleasing, the good visual design. So there is overlap between these columns and these questions we shared out, because making something visually pleasing with colors that are thoughtfully chosen so that they coordinate and complement one another can be a good best practice, and also make a chart easy to understand if those charts have appropriate meaning. In data visualization, there's a lot of choices that go into color. So I wish we had hours to talk about it actually, because I think it's really important. But if you are somebody who has a good resource around colors, feel free to share it in the chat. Speaking of, I'm just looking in the chat and seeing a few more comments from Bernard. So thank you, Bernard. I see that your health departments used some of the trainings to reflect lessons learned from the data visualization training you've had. That's great.
And keep in mind, the way they used to do it was black and white tables and charts. So no one from the public or providers would probably ever read them. So it definitely helped upgrading it.
Yes, that's a great point. So if you look at older charts, you'll see a lot of cross-hatching and different patterns on different components of the data charts, because everything was meant to be printed in grayscale and they needed a way to differentiate. Now that we communicate primarily electronically and are sharing things on websites or by email communications or in other ways where people can see the color, we need to be very thoughtful because everyone sees color a little differently. For accessibility, we want to think about color blindness as well. And if we have colors that people with different types of color blindness can discern from one another. So we're going to be sharing resources that help you to make sure that you choose colors that are colorblind friendly, and that do help your main point in your data register with people. And I see a lot of people talked about the highlighting aspect with colors. So could somebody who made the comment like shading and colors to highlight needed information, could you talk about what you mean by that and how you use color and shading to highlight?
Mary, I'm curious in the, in addition to shading, I see somebody here in the green under the visually appealing wrote color, but make sure the color scheme helps communicate your intentions. I'm a little curious about how you think about color communicating your intentions. So if the sticky note writer would share, that would be great.
Yeah. I've seen some charts to where like they use lots and lots of colors, but then they were almost like inverted highlighted. Like the information they're actually trying to get at was like less noticeable than unimportant stuff. So it was kind of hard to differentiate from that.
Yeah, thank you. You know, color is one of those characteristics that us as humans are really drawn to, right? So when we see a chart, our eyes often go to the boldest, brightest colors in whatever visual we're looking at. So using color intentionally within a chart is really important. So someone already mentioned that a lot of times you will design a chart with most of the data bars in gray and color being used to highlight just one area. When you've got categorical data, and you're like, let's say you have 10 different categories you are visualizing and you're using 10 different colors, that's an overwhelming amount of information for people to process. It makes our brains not really know where to focus our attention. So it's really important to be careful about those color choices and to not overwhelm people. I see lots of information and guidance on these sticky notes that really aligns with the things that I want to talk about in this session. So we have to move on to the next part of our agenda. But before I do, if anyone has any questions or anything you were curious about with what's written on the Miro board, I invite you to ask your question now before we move on to slides. Okay, I've seen no questions in the chat or hearing no questions. I'm going to move on, and Jennifer's pulling up slides now. So, high level, these are some of these characteristics of good data visualization we've been talking about. So, I'm not going to spend too much time on any one of these because we'll be talking about some of them in much more detail. But, just to briefly review, good data visualizations are easy for our audience to understand. A lot of you said, you don't want to overload people with information. You want to make it simple. Accessible is also really important. So we are talking in this session about accessibility and inclusion, and there are lots of strategies we'll discuss more in this session that are specific to accessibility. Having a clear message in your visualization is also really important because we want to make things as easy as possible for the viewer again by not having them have to do so much work to figure out what our chart is saying. We want a clear message or key insight that is as easy to understand as possible. We have to make things relevant to our specific audience. So if you are, communicating to a skilled nursing facility about a local outbreak, for example, you need to make sure that your key insight is relevant to them. Make it easy to see the risk for the patient population that they work with. It's really important. I saw on the Miro board, somebody said you have to choose the right type of chart for your data. We're gonna talk about that in more detail on the slide after this. You've got to use good design principles. So that's our green column on the Miro board, where you all put lots of great tips for design. So I am not an artist, but I have learned through my practice in data visualization that I need to leave white space. I need to think about color. I need to think about font. I need to think about the characteristics of all of the text and ink in whatever visualization I'm creating using good design principles. It is essential that we have data visualizations that are accurate. I heard lots of good conversation about this happening in your small groups too. Accurate means that we are communicating all of the most important information. So I didn't mention this at the beginning, but I teach epidemiology, and I'm always, talking to students about making sure that we have, descriptions of our data that touch on person, place, and time, the characteristics of the people involved, defining our populations very specifically, defining the geography very specifically, and also the time period from when our data were collected. You have to also add the data source and, make sure that people, can go back to that source as needed for the information they want. Labeling well is really important, and we're going to talk about this in this session. So making sure there's direct labeling whenever possible is one of the strategies. So putting those numbers right on your data bars, or the labels as close to the data that are connected to them as possible. And lastly, you've got to make sure you're providing context, okay? This is the story of why your data matter. So, you need to give people context and let them know, where these data were from, that they were collected by a reputable source, that, we're seeing a trend that, has increased our rates of this disease over time. That story and context that make people care about the visualization is crucial. So if you looked at charts around the data, there's no context for those. So you probably didn't connect with them. But that's one of the things we have to keep in mind as we go. All right, so we're moving to which chart types are easy to understand. So I pulled up this infographic to show a few of the different many chart types out there that are available to us now in different software tools. So think about this question and put in the chat which chart types you find easiest to understand. Okay. The pie chart needs to go extinct. First comment in the chat. Bernard, I love it. Tell us why the pie chart needs to go extinct.
It just becomes harder to visualize, I think, and communicate. And a lot of it, you could actually just turn it into a horizontal bar chart or something, a way that it's just a little bit easier to communicate. I think it just gets overwhelming.
Yeah, and I think a lot of the data visualization experts out there would agree with you that pie charts are not the most effective way to communicate four or more groups. And one of the things I've heard Stephanie Evergreen teach about is how difficult it is for humans to make sense of angles in those pie charts, right? We're not good at thinking about angles as a way to make meaning, but we're really good at comparing the size of different length bars, okay? So a bar chart makes it easier for our brains to understand which groups are larger or smaller. So I'm seeing lots in the chart here in response to the question. So I usually default to either line graphs or sorry, my chat just went off, or bar or column charts. And I see some agreement. So Emily, tell us why do you usually default to those? Why are those your go-tos?
Well, actually, so Bernie, that was hilarious about the pie charts. Because we generally try to at all costs avoid, generally at all costs avoid pie charts. So I feel like kind of the simplest thing is the next simplest thing is a bar chart, and yeah, I just find them easy to see the comparison. We also do a lot of horizontal bar charts instead of pie charts. So that's kind of some of the other ones on here, like I just find them, even for me personally, too confusing to look at. Like I don't like every time I see a tree map, it makes my head hurt a little bit. So, especially for public facing things, I find some of the simpler charts are easiest.
Yeah, no, I agree absolutely. Polar diagram, one of those charts on this. I've yet to find someone in an audience who understands that one immediately and intuitively. It's just a really complicated chart type for most people. So yeah, I'm seeing some agreement from Elise. Anyone want to chime in before we move on? Okay. Well, thank you for participating. Oh, I see one more comment. I like mind maps for non-data. Yeah, some of these are just diagrams, different charts. So there's lots of ways to go with our chart types. Jennifer, if you move to the next slide, I want to talk about choosing your chart. So there are lots and lots of different data visualization chart chooser tools out there. We're going to include some links in our resource list to a few different options, but I put this one on the slide. Actually, right now you only see the start of the decision tree for the data visualization chart choice. I chose this one because I like that it narrows your choices to a few simple stories that I think we really commonly see in public health. So the chart choice you make is going to depend on whether you're trying to show how a disease, changed over time. If there was a spike, an outbreak, for example, or if you are, comparing and contrasting different categories, showing where the rates of a disease were highest or lowest, which groups are most at risk, those kind of things. The story you want to tell leads to chart choices. And Jennifer, if you want to advance it, I'm not going to talk about all the different choices, and this is just one of many chart choosers, but any good tool should start with that key question of what is the purpose in what you're trying to communicate? What is your message? Is it about change over time? Okay. If it is, what does your data look like? Is it about data being part of a whole and how different things within a group changed over time? Or is it about how just one group changed over time? That's going to inform your chart choices. So there's lots of ways to narrow down, but you really need to make sure you're putting some thought into chart choice and not accidentally using a pie chart, for example, when that's not the most appropriate tool to really communicate your message. So we'll include the link to this as we go. I'm going to talk about accessibility and inclusion, and then I think this is our last slide before we take a quick break. Some of these principles we've already touched on, but all of them are important. And I also want to share with accessibility that a lot of times we think about accessibility in terms of how we can comply with laws around accessibility, like Section 508 compliance, for example. We are thinking about accessibility more broadly and how we can make the visualizations most accessible to most people through lots of techniques that extend beyond what we have to do to be compliant. So using simple language, having a meaningful text hierarchy where the more important text is bigger than the less important text, but it's all big enough in a large enough font for people to read, okay? At least 12-point font, ideally. Providing our data in different formats is also important. So if you are including a chart, you also want to link to a table where, or a site where people can find the data in a table format. That can be really helpful for making sure people who can't see that visual can access the information. You want to use alt text for every visual. This is not negotiable. This is part of compliance with rules. Alt text is that explanation we put in of what our visual is saying for people who use screen readers and are not able to see the image that you've created. You want to consider colors carefully. We've said a lot about that, and I see that Color Brewer was added into the chat. That is one of my favorite go-to sites for choosing colors, as is the one that you see on the screen, the Project Susie Lou site. That's another site that lets you see your data in different colors as people with different types of color blindness would see them. And lastly, you want to focus on labeling data directly. So making people see the data values right next to the bars if you're doing a bar chart, and not making them go back and forth between a legend that is farther away. So all of these are important practices I'm seeing. So I'm going to stop talking now to see if there are any questions before we move to a break. Any comments, thoughts, questions?
Oh, question. Did we talk about icons yet? I can't remember, because sometimes you can use them to orient your audience, mostly for presentations and posters, I would say, to what your data is trying to say. Or if you want to put an icon with a small message of your data. I've seen a lot of posters at CSTE this week that were doing that.
Yeah, icons can be really useful. You know, we're drawn to images, so anything that helps us graphically, link to a message or any graphic that helps us reinforce that message can be really helpful. So thank you for chiming in. Think about, so for each chart we look at, I want you to think about what works well and then what you would change. So let's move to the first chart. Okay, so this is a chart of positive influenza cases. And first, I want people to think about what works well about this chart and put those comments into the chat. Or if anyone is brave enough to come off mute, you are welcome to chime in and tell us what you think is good about this. What are they doing well? Okay. So first up, I see Bernard says axes are labeled clearly and they chose an appropriate chart type. Yes, so we're visualizing change over time for different years. Those are both good observations. What else do we like about this? Okay, Ashley, the scale for number of cases fits well. Right. That's good. And what do you mean by fits well? Do you mind coming up
Yeah,
to tell us what you mean?
I would just say there's no large gaps, and especially not like a large number of cases and a high number, and then cases that are at low count. It seems to fit all of the data sets into the picture pretty well.
Right. Yeah, that's good observation. Anyone else have any thoughts? That you're all ready to tell me what you don't like about this one. So what doesn't work? What do you not like about this chart? Okay, cons are coming in already. Bernard, do you want to share?
Yeah, I actually make this type of graph every week for our respiratory surveillance locally. I would say the title is just not clear. You would really want to say something like positive influenza cases, over seasons, Florida Department of Health in Polk County or something. What am I supposed to take away from positive influenza cases if I'm like a health officer or some sort of stakeholder? I definitely don't like that. And then the big red flag is the red and green colors together. It's not colorblind compliant, I would say. And it's also, they're highlighting the current year by making it bolder, but what you could do instead is keep it all the same, like width, sorry, and just kind of have the other years like a duller color within the same color palette, I would say.
I would absolutely agree with all those comments. So the use of red and green together is one of those absolute no's when it comes to accessibility. Um, it would be much more effective, I agree, if they used color to just highlight the most recent year and not have blue, green, and brown for the other years. Um, and the title could be changed to be more meaningful. Um, I'm seeing get rid of the grid lines. Yeah, so some people refer to those grid lines as chart junk. It's just extra ink that you do not necessarily need in order to see the change. People debate about how much value grid lines have in different kinds of charts. So it's not like you should remove them in all charts, but many people would get rid of them. I see a comment from Melissa. Having the n equals is not necessary for this type of graph. And a lot of thumbs up for that. So Melissa, tell us why. Why'd you say that?
I would say that because that's the whole point of the graph, is to kind of give you magnitudes and comparisons, and individual down to the individual case numbers just really doesn't add to the picture, to the visualization of the information you're trying to convey at this particular point. It's just additional information that really doesn't make an impact to other people. It's just more numbers to look at, but really what, this type of graph is conveying, hey, this is where the peaks are happening. This is the magnitude of the peak. Look at these different years and what they're doing. And not necessarily the the story is not, oh, in the 2022 to 2023 season, cumulatively we had 347,250 cases. That's not what you're conveying with this image.
Agreed. Yeah, and it adds a lot of extra information that our brains have to make sense of as we're looking at this. So if the point was to compare the change over year in the N, that would be a completely different chart. But that's not the point of this, like you said. So that's great. Thank you. Thank you for sharing that. So Jennifer is moving us on. We are committed to getting you all plenty of practice time in this session. So in the interest of time, we will move on and start critiquing this next chart. So tell us what works about this one. What's good? One thing I personally appreciate about this chart is that on that x-axis, the labels are written horizontally rather than vertically. So it's easier for me to, register what those mean because I'm reading in the way I normally do, left to right, rather than having to, think about it going the other way. And Bernard, I totally agree with your comment that these are great exercises to do with your teams. So there's no such thing as a perfect chart, but there is lots of opportunity that we can all see once we take the time to examine charts, to identify what's good or bad. So anyone see anything good? Yes, Melissa again. So single line is easy to follow. I agree. One line is definitely easier than four to make sense of. Emily says, I like the call out boxes on this one to add a little more data without overcrowding the line graph with numbers. Right. So do you want to say more about that? The annotations?
Sure. Just thinking that oftentimes with line graphs you see like people, it's like we've done graphs too where you label every single point in the line graph, and that I think for the most of the time becomes too crowded. So I kind of like what they did on this one is labeling labeling the year with the highest number of cases and then labeling the most recent year to just give you a couple of kind of addition, like the rates and the actual number of cases, but without making it too complicated.
Yeah, highlighting those key points can be really, really helpful. Absolutely. All right. Thanks for sharing that. And I see Bernard says, I think the vertical scale is off. There's a threshold at the bottom of the graph. I'll have to look at that more closely. But just so we can move to our activity in time, what don't you like about this chart? Let's move to our next question. Or what would you improve if you were visualizing this data? I'll tell you what I personally would improve is those annotation boxes. I don't like that they're so that they're outlined in a dark color. I feel like that's taking a lot of attention, and I might put like a light gray background or something to be a little more subtle in how I call them out. I see Emily says, I don't think the elimination threshold stands out enough. I agree. Do you want to say more about that?
Yeah, I think just like initially glancing at this, I almost didn't even see it. Like I wasn't drawn to that at all. And the point of this graph is like progress towards that elimination threshold. So I don't know if even if like the line I think it looks like it's like purple. Even if it was maybe a different a different color, or like that elimination threshold note being like Bernie said, with like, yeah, like even in a text box with like an arrow or something pointing to it instead of just right above it. But
Yeah, I agree. I'll also add that we are a group that has an idea what elimination threshold means. To a lot of people out there, that is some jargon. That means nothing because they're not schooled in public health. So if I were writing this for a general audience, I might be a little more clear about what I mean by reaching the elimination threshold. Yeah. I also see Bernard's comment, include milestones using arrows without being boxed in. Yeah, I think that's a better idea maybe, is not using those heavy outline boxes. I agree. And actually, if you move to the next slide, Jennifer, just to move us along, this infographic here shows some more subtle ways you can call attention to data using graphical cues. So Bernard, you mentioned icons. That this image shows both icons and emojis as options to us, but those are easily understood graphical cues that draw our attention to a particular point in a chart and helps us make sense of it. In each of these, they're using color, and in a lot of them, they're using shape to take advantage of those pre-attentive attributes that our brains are cued to use to make sense of information. They're the things we do unconsciously. So I'm going to show these few charts real quick just to show there's lots of different options when you're visualizing differences between groups. So we could use population pyramids, stacked column charts. We wanted to talk about the differences in how easily understood the data were between these charts, but we don't have a lot of time for that. So I'm going to ask Jennifer to show the last two chart types, which are multiple bar charts and a proportion plot. And one of the purposes of comparing these different options we have for seeing data was for you to think about how easy it is for you to get messages from charts of different styles, but also charts that have pretty generic titles versus those that have meaningful titles. So I know that's been mentioned a few times already in this session, but this last chart, the proportion chart, is the only one to have a title that tells you the main message of the chart. So if you go to the next slide, Jennifer, I'll show you an image that was produced by Anne Emery, another one of the data visualization teachers out there on the internet who has a lot of good teaching around the use of takeaway titles and direct labeling and use of color. So this chart shows in that default column how Excel might automatically by default show some data. The traditional image there has that same data, only with some direct labeling and larger font and larger bars. And then that last one actually puts the takeaway message right up front into the title. It's called the storytelling approach. And that is something I've seen used over and over again across the experts in this field right now as a way of making sure that our information is most easily understood. And there's research behind it. People understand and remember our data better if there is a meaningful title used. So your message can be your title. And we're going to practice this in just a minute. So Jennifer, if you want to move to the next slide. I have a few general tips here, questions that we should all be thinking about before we design any data visualization. These are questions we're not working through today with our practice because we're going to focus mostly on the mechanics of how you implement these principles that we've been talking about for almost an hour and a half at this point. So we are going to move into our Excel practice with the file that was emailed to you before this session. If you do not have your Excel file available to you from the email, then you can use the link that Erica just put in the chat and pull up this file here. And I would love if everyone could give me a thumbs up once you have that handy. And while you do, I'm going to start introducing this next activity. So we're going to hopefully give everyone time to make two different visuals today. First is a bar chart, the second one's a map. So in the Excel file, I've got a lot of sheets. Don't panic. You only need a few of them, really. But this first sheet in the purple here has your raw data. The second sheet has your instructions, okay? And the sheets with the instructions are where you're going to work today on your visualizations. We're going to be doing this in groups, and I'll walk you through what you're going to do. I'll start with the bar chart and us doing this as a group once I have thumbs up from everyone. So Jennifer or Erica, can you tell me, do people have the file they need? Do you get all the
I
thumbs
saw
up?
a few folks that I didn't get a thumbs up from. I don't want to call them out, but if you don't have access, you haven't put your thumb up, please send a note to Erica and we'll give you some help.
Yes, I've seen about 4, but if you need help downloading the file, if you click the link, please let me know and I'll definitely help you download the file so that you can do the activity as well.
Okay. So I see that we have most people working in Excel. So I want to invite you to just follow along with me as we start here with step 1 for the bar chart so you get an idea where we're going, okay? So step 1 is creating a chart, the bar chart. So we're going to highlight the data at the top, go to insert up here on your ribbon, and go to recommended charts right here in the charts area and click on it. We all have different versions of Excel. Yours might look a little different than mine, but you should all be able to follow along with the activity we've provided. So for me, clustered bar is the first choice as a recommended chart when I pull up this dialog box. If it's not for you, you can also go to this All Charts tab right here and go down to Bar and select Clustered Bar and click OK. And there is step 1, your basic by default Excel chart. But as you can see in the instructions, we have a lot of steps here that will help you to make your visualization more effective by sorting the data meaningfully, giving it a meaningful title, et cetera, et cetera. So I'm not going to walk through all of this because I know everyone works at their own pace. And I think a lot of people are more inclined to ask questions and work on things creatively when they are in the small groups where you all can talk more. So our idea is that you will take the time in your group to first be on this chart, this sheet called bar chart instructions, working through the steps here, okay, to create your own bar chart. I have a sheet that shows what my finished chart looks like next, but yours might end up looking pretty different. When you are done with the bar chart, we are inviting you to move on to a second exercise where you will create a map in Excel. Maps, I know, are not, the default visual we associate with Excel. A lot of people may be working in ArcGIS or fancier software, but Excel can be good for a very basic map. So I want to walk you through the steps of doing so. I did include all the data steps for those of you who are interested in the analysis steps we started working through 2 weeks ago. But really, you can just start on this Maps Instructions tab, which is the second one from the right. So Maps Instructions is right there. And on this chart for step one, again, the first step is to highlight the data. And I realize I did not say just highlight this data in the black typeface first. So you want to highlight your data, go to Insert, and then you can just select Map and Filled Map to get the start of your chart here. Okay. The Mapping Helper column is something explained below if you want to create a map where all the hotspots are the same color. Okay, so this is working through that example with New Mexico zip code data that we started a few weeks ago, where you need to highlight hotspots that you are working in for your community. So I'm going to pause there, and before we go to breakout groups, just to recap our instructions, okay, and see if there are any questions. So we're going to spend until 3:45 in our breakout groups. We'll see how folks are doing and adjust time as needed, but that is our plan today. We want you to start on the bar chart instructions tab and work through the steps, okay? If you get stuck, you can ask members of your group for assistance, but also you could use the Ask for Help feature in Zoom to pull Erica or I into your room to help answer some questions. You find that by just clicking the 3 dots in the bottom of your Zoom screen and then Ask for Help. So ask for help for you need to. When you're done with the bar chart instructions, then you switch over to the map exercise and try to work through all those steps there to create a more effective visualization of some geographic data. And if you have time when you're done with your 2 visuals, then please talk to your group members about how you can improve on these visuals or what other things you might do with the data. So I'm going to stop talking and saying, who has questions before we go into the breakout groups? Any questions at all? Oops. All right, I think we are ready. So Jennifer, send us away. Okay, everyone, welcome back. I know from the groups Erica and I went through that there was a lot of good work being done. So I want to hear how it went. So will anybody be brave enough to come off mute and share how that went? What went well for you? Or what did you struggle with? We recognize not everyone finished both visualizations, but from the people I talked to, I know that a lot of folks got through the bar chart. So those of you who did get through that first visual, what steps were new to you, if any?
So how about folks give us a thumbs up if you were able to finish the bar chart. Let us know if you finished the bar chart with a thumbs up, please. Susan, yay. Forrest, yay. Emily, woohoo. All right. And Ashley, good job, Ashley. Why doesn't Emily, can you tell us what went well for you doing the chart?
Sure. So I like the instructions were helpful. And we've been trying to work on recently actually creating some like updated graphs that kind of look like this. So I liked the kind of the prompts and the instructions to like think about how the font size looks and think about the colors. And I really found that website for the helping to write the alt text helpful. That's not something that we've historically done for things. So that I think, thinking about that accessibility piece going forward will be important, and I think that'll be a really helpful tool.
I'm so glad to hear that, because that's really, it really is, one of those essential pieces which we're prompted for more and more in software, but it's a step that was not something we were ever trained to do as we learned to make charts in school way back when. But it is something we know now is really important to people who aren't able to view our charts, and to use screen readers and other devices. So I'm glad you found that helpful. Um, who else has something to share about what went well for you, or what you struggled with? What about the map making? Was that new to folks? Map making in Excel, anyway?
I was going to say, give us a thumbs up if you finished your map. Let's see who finished it. Okay, give us a thumbs up if you started making your map. And now you're on to me. You know that if I see your thumbs up, I'm going to call on you. So thanks for doing that. Melissa, talk to us about the map making.
Something I've done in Excel much. It's not really a feature you usually use too much in Excel. The instructions are pretty clear. It's not that difficult to navigate once you remember how to deal with Excel. New Excel buries your options in places that when I learned Excel the first time, it's not where they used to be. And I still struggle with things that are not where they're supposed to be, even though I know it's been this way for several years.
Yeah.
Yeah, they always change things just a little for us. So thank you for sharing that. I see Bernard in the chat. I think for me, I like to play around with these things in advance to get comfortable. So wish I'd done that. Yeah. Yeah, it's a learning journey, right? We all need to play before we get really good at this. Emily?
I did a quick question. I think in the bar chart, at least it was in the instructions to include the source in the alt text, but like neither of the examples had the source of the data anywhere on the actual graph. So I was just wondering if is there best practice for that? Because I think for us, that's something I don't think we get away with, not including a data source within the graph, with our leadership and stuff. I just don't think that would fly.
Yeah, no, I think when I was writing them, I just put XXX or some placeholder for putting the URL to a data source. But you're absolutely correct. You should name that data source as well in there. So connect people to the data whenever you can.
Yeah, I just want to double check. Thanks.
Yeah. So Jennifer, I'm gonna wrap up this discussion unless anyone has anything else to say on their map making and bar chart making experience with us.
All right, and they can continue to use that Excel sheet, right, Mary?
Absolutely.
Okay, so for those of you that have stuck with us till the end, we want to make sure that the next session, which is on June 25th, is most responsive to your needs. And so we have a couple of questions for you. We're going to be looking at tool selection and application. So which tools are best for which types of charts and visuals that you want to make. And so I want to start with a question here on a Slido poll. If you can either click the QR code with your phone, or you can join at slido.com. And if you can tell us what data visualization platforms your health department has access to. So we used Excel today. Do you all have access to any other? I'm so sorry, y'all. something is not right. Let's try that again. Okay, there we got the answers. All right, so we've got Excel, Tableau, and ooh, all right, Power BI. Okay. This is really helpful to us. So let me go to the next question, and that is, what kind of charts are you most interested in learning how to make? So you should have the option to choose two. So if you can choose your top two, that would be great. Heat map. Looks like heat map is in the lead, followed quickly by combo chart. Bar chart, line graph, okay. Not seeing, nobody wants to do the pie chart, surprise, surprise. Okay, this is really helpful. Appreciate the input, and I want to thank you all for your time today, and I hope that you have a wonderful afternoon. We'll see you here in 2 weeks.
Thanks, everyone.
Okay,
Are we still recording?
no,
Okay.
let me just oh wait, no, yep, sorry.